Hello everyone, I am Dr. Mahalakshmi, educator, forensic medicine and toxicology. In this video, we are going to see about mechanical wound. So, mechanical wound forms most important part of your subject. In every question paper, there will be some sort of question from this chapter, and anywhere you go, they will definitely ask you about this mechanical wound, and even in your daily practice also, you have to know about this mechanical wound to give wound certificate. So, with this in mind, we will start this chapter. So, first, what do we say by mechanical wound? So, mechanical, the word itself means something mechanical, it is causing a wound. So, first of all, we have to know what is a wound and what is an injury. So, as far the law is concerned, wound is something that involves body. So, bodily injury or impairment, we call it as wound. Otherwise, whatever that happens to your mind, reputation, property, everything will be covered under injury. So, injury deals with your mind, reputation and property. All these comes under injury, and wounds covers only bodily injury or impairment. So, when we say wound here, mechanical wound here, we are going to talk about only the physical aspect, only the bodily impairments we are going to talk about. So, according to the classifications of wound, we have multiple classifications. There are like multiple things that can lead to these wounds. We already saw the thermal wounds, we saw the explosion wounds, everything we saw. Now, what you are going to see is mechanical wound. Something mechanical, like some mechanical force, physical force will cause you wound. That is what we are going to deal in this chapter. And broadly, this mechanical wound, it is divided into two. One is your blunt force trauma, another is sharp force trauma. Depending upon the force, whether it is a blunt trauma or sharp trauma, we are dividing the mechanical wound into different classes. So, by blunt trauma, you can get abrasion, contusion and laceration. So, blunt trauma means something that is not sharp, like your cricket bat, some wooden stick, hockey stick, something that is not sharp, something that is blunt. It will lead to only these type of injury, that is your abrasion, contusion and laceration. And if that trauma, that force causing it is very sharp, like a knife or axe, these kind of cases you will get incised wound and stab wound. This is what you will be getting. So, when we say mechanical trauma, we will be dealing mainly with these, whether it is a sharp force or a blunt force trauma. If it is a sharp force trauma, we will get either incised wound or stab wound. If it is a blunt force trauma, we will be getting abrasion, contusion or laceration. So, basically these are the 5 things that we are going to deal in this chapter, and these 5 things are very important. Each and every aspect of this is a question, and it is a must know topic for undergraduate examination. So, with this basic ideology, blunt force and sharp force trauma, we are going to enter into the actual classifications. So, first thing that we are going to see is abrasion. So, abrasion, when we say abrasion, it is a very superficial injury. It is a superficial injury, and it is caused by a which force? Blunt force. And the other thing that we have to know is which is the part involved. Here it involves only epidermis and dermal papillae. So, these are the area that is affected by this blunt force. So, when a blunt force causes injury affecting only your epidermis and dermal papillae, we call it an abrasion. It is a very superficial injury, and this always heals without any scar. So these are the character of a abrasion. When we call something as an abrasion, it has to be very superficial, it should heal without scar, and it should be caused by something blunt. So this is the basic definition of an abrasion. And how is this abrasion caused? We already saw that it is a blunt force trauma, and when that blunt force trauma acts tangentially, like if this is your skin, and this is the force, blunt force action. If it is acting tangentially to your skin, you will get two type of abrasion. One is your linear abrasion. Another is your grazed abrasion. So these are the two types you will get when the force is acting tangentially, and if it is acting perpendicularly, so when the action is perpendicular, you will get two types, that is this pressure abrasion and this imprint abrasion. So basically abrasion is something very superficial, and it involves only epidermis and dermal papillae, and the force that involved is blunt force. And when that blunt force acts tangentially to the skin, you will get either linear abrasion or a grazed abrasion, and if it is perpendicular, you will get a pressure abrasion or an imprint abrasion. So these are the definition and classification of abrasion. Now we will see this each and every type. So this linear abrasion, it is also known as scratches. This is what you basically get when we use a tip of pointed object, right? Like a knife tip is used, or your nail that is somewhat sharp, not very sharp, like those kind of thing that will only scrape away your epidermis. Those kind of injuries, it is known as linear abrasion, also known as scratches. And the most common example is nail abrasion, your fingernail abrasion. And this fingernail abrasion, it also attains a specific shape, most commonly semilunar shape abrasion. So this is your linear abrasion, also known as scratches, and it is caused by tip of a pointed object. So this is the first type. Second type is this grazed abrasion. Here what will happen is that it is most commonly seen in road traffic accidents. So when this perpendicular force is acting upon your skin, you will either get this pressure abrasion or imprint abrasion, and when it is acting tangentially, so this will cause this graze here. This will act like this. So you will have the whole skin grazed by that force. So because of the grazing action, you will get this gravel rash. So this type of injury, it is commonly seen in road traffic accidents, and this is mainly due to the tangential action of the blunt force, and this is very commonly seen in road traffic accident, which is very important, and it is also known as gravel rash. So up next what we have is this pressure abrasion. See here, if you can see the ligature material, right, and this is your ligature mark, and this ligature mark, it is a typical example of pressure abrasion. And what happens here is that the pressure will act for a long time, and the amount of pressure will be very minimal. So minimal pressure acts for a very long time over a small area, okay, over an area perpendicularly. When this happens, you get this pressure abrasion. So, an example, very common and typical example is this ligature mark. So, you have a perpendicular force acting upon an area for a very long time, and that force is very minimal. So, when this happens, you will get this pressure abrasion. If it is a very large force, it is a very large force, and if it acts for a small time over a area, you will get imprint abrasion. See, you see the difference? You have a force which is minimal but it acts for a long time. Pressure abrasion. You have a very large force acting for a very small time. You get this imprint abrasion. Clear? So, imprint abrasion, it is commonly seen in tire mark or any shoe kicking. All these can be an imprint abrasion, and the most important advantage of this is that you can identify the weapon by the pattern. So, the pattern of the weapon is imprinted. That is why it is known as imprint abrasion. So, when you get tangential, you get linear abrasion or grazed abrasion. When you get perpendicular force, you get pressure abrasion and this imprint abrasion. So, this is the important type of abrasion depending upon the direction of the force and the time upon which it is acting. Based upon these two, we have basically divided the abrasion into 4, and every example for every type of abrasion is important. And this example, ligature mark being typical example for pressure abrasion, this is very important. So, next. So, based upon the color of the wound, we can also identify age of abrasion. So, age of abrasion we can identify. So, first, if it is a bright red color, it is a fresh wound. If you see an abrasion with bright red, blood oozing out, this is a fresh abrasion, and granulation tissue will come and deposition of fibrins will come. So, there will be scab. You will see grossly, you will see the scab formation, and which means 1 day has passed. So, if you could see this bright red scab, it is 1 day, and after that it will become reddish brown scab. So, initially it will be red. That is what you will see, that bright red color like this. You will see this bright red color, which means it is a very fresh wound. And if you start seeing a scab over it, it is a 1 day wound, and when the color changes to reddish brown, from red to reddish brown, so RB, you will get a scab. Okay, reddish scab, reddish brown scab. If you get reddish brown scab, it means 2 to 3 days has passed. Then you will again become dark brown. Scab will remain. Once the scab has come, till it resolves off, it will be there. So, red scab, reddish brown scab, then brown scab, finally it will fall. The scab will fall away. So, fresh is first, then you have 1 day, 2 to 3, then 4 to 1 week, then 1 week. So, this is the time period. Bright red, fresh. When you see the red with scab, it means 1 day. After red comes your reddish brown, becomes 2 to 3 days. Reddish brown will become dark brown. So, it is 4 days, and scab will fall off more than 7 days. So, based upon the color of the abrasion, you should be able to identify the age of the abrasion. So, this is how average age of an injury is calculated, and this is also very important. You can remember by RB, okay, RRB, then again B, R square, B square, like that. First it will be R, then RB, then B, like that, R square, B square. Initially it will be R, then it becomes B. Like that you can remember the color, and 1 to 4, 1 week, like that the days you can remember. This is the age of the abrasion. So, next comes another important aspect of abrasion, that is the epidermal tag. When we say epidermal tag, what is that? It is simply the heaping up of epidermis. So we already established that abrasion is simply affecting the epidermis. So when it is affecting only the epidermis, when the force is acting, it will keep on heaping up the abrasion. So it will heap up, it will lift up the epidermis, and at the end of the injury, like where the force stopped to exist, it will just collect all the epidermis. So all the epidermis, it will come and heap over at the end of the injury. So when the injury stops, when the force stops and when the injury stops, at that point you will see heaping up of epidermis, and that heaping up of epidermis is known as epidermal tag. And why we want to know about this epidermal tag is that the direction of the impact and the direction of the injury we can determine. This always comes at the end of the injury. So if the epidermal tag is here and the injury is starting from here, we can say the force was traveling in this direction. So this was how the injury happened, like the direction of the impact we can identify. That is the importance of this epidermal tag. So direction of impact. Now we have seen about direction of impact. Next, what we have to know about is antemortem and postmortem abrasion. So what do you mean by antemortem abrasion and postmortem abrasion? So typically it means like an abrasion that happens before death is antemortem and abrasion that happens after death is postmortem, right? So where all you can expect this postmortem abrasion? That is first question. So commonly when there is a rough handling of body, especially in mortuary, when they are trying to shift the body, there is a chance that they may handle the body roughly, or because of the weight and non-compliance of the body, there is like more chance to get injury. So under that circumstances, you will be seeing certain abrasions over the body, and those abrasion, even though it is postmortem, to an untrained eye may look like an antemortem abrasion, and people may falsely believe that as an antemortem injury and thereby suspecting something else. So for example, look at this injury. They are seeing this injury over the arm, and in like if they don't know about this concept of postmortem abrasion, what they will think? They will think that like it is looking like some grazed abrasion, right? So something must have happened. The body must have been in some sort of traveling, like some road traffic accident must have happened. Like that they may have an idea. So this idea, this will create some false confusions, which is not good, right? So just to have this like confusion taken away from your mind, we have to know about this postmortem abrasions. So postmortem abrasion most commonly happens because of the rough handling of the body, or when the body is so heavy, people are not able to shift it properly. During that time also, this postmortem abrasion will happen. And this postmortem abrasion, how it differs from antemortem abrasion, we have to know. So the first and foremost thing here is that this postmortem abrasion, this is commonly seen in bony prominences. These are the areas which are more prone to injury when you are shifting, when the body is so heavy. Which is the part that can get easily injured is this bony prominences. But antemortem abrasion, no such preference. You can get anywhere. Abrasion can happen anywhere in the body if it is an antemortem abrasion. And the next important thing that will help us differentiate is that, see here, if you look at this abrasion, what the striking thing that is coming to you, this is very pale, right? It will be very pale and no scab. The main difference, you will not be seeing any oozing of blood. See here, this, how reddish this is looking, this abrasion, how reddish, how bright, and you can also see the exudates. Like if it is sometime have passed, you can also see the exudate. But here, look at this picture, this is very pale, there is no scab, no exudate, nothing will be there. Just by looking at the lifeless wound, like it will be no color, it will be very pale, it will be very lifeless. By seeing at that, we can identify that it is a postmortem abrasion. This is the most striking feature that you have to know. When you see an antemortem abrasion and postmortem abrasion, you will be able to find out like something is wrong with that. this is not having enough oozing of blood, not having enough exudate. By that you can identify that this is a postmortem abrasion. Apart from that, you can also looking at the location, whether it is presenting over the bony prominences or not. By looking at that also, you can identify whether it is an antemortem abrasion or postmortem abrasion. And this is the main difference. And if you look microscopically, here in case of antemortem abrasion, you will be seeing all vital reactions. Like all the enzymes will be elevated and you will have the polymorphs coming to the injuries. For healing purpose, polymorph everything will be migrating to the injured area. But here in postmortem abrasion, there will be no vital reaction. So based upon these differences like location and the color and the vital reaction, you can differentiate an antemortem wound from a postmortem wound. And this antemortem postmortem wound becomes very, very important while you are dealing with like unknown cause of death. So if somebody is suspecting something and they are finding this kind of postmortem abrasion, they will surely think, okay, this has to be some antemortem injury and something suspicious has happened, like that they will think. So just to have a clear idea, you have to know which is an artifact and which is a real injury. So that is the important thing regarding this. And next thing that we have to know is differential diagnosis of abrasion. Like what are the other things that can look like an abrasion but not an abrasion? That is very, very important. So first thing that we have shown here, this is an ant bite excoriations. So what this is that, here do you see this white, this area, these, all these things, these are ant bite marks, okay. So these, like when the body is stored in a mortuary, if the mortuary is not well maintained or if the body is lying somewhere open, there is more possibility that ant will come and bite the body. And this biting, it happens mostly at the junction of mucocutaneous, like the eyelid margin where the mucous membrane and the skin is contacting, that mucocutaneous junction, you will be seeing this most commonly around the eyes. So most common site is your eye. This is where you mostly experience this ant bite. And this ant bite, if they don't know about this ant bite thing, they may mistaken it for some sort of injury and it may confuse the final diagnosis. So this is one important differential diagnosis for abrasion. And when you look this under microscopy or under lens, like normal your optical lens, if you look under it, you can find this bite lenticular shape injuries. Like the exact shape of that injury, it will look like a, like when conical lenticular shape bite marks you can see under the lens. So this is one important diagnosis. Apart from that, there are other conditions which can simulate an abrasion. One is burns, especially when it has dried up. It will become very, very dark brown color and it will look like an abrasion. And other differential diagnosis is diaper rash. This diaper rash, it will look like an abrasion, like there will be constant pressure over that area and there might be excoriation also. Because of that, it will look like an abrasion, but it is actually not an abrasion. Then drying up of skin. Example over scrotum. When these like loose skin, they dry up, they will become very dark in color and it will mimic an abrasion. So these are the differential diagnosis of abrasion. So you have to differentiate when you look at a wound. If you don't see those typical features of abrasion like this bright red color with oozing of blood and all those exudates, you have to think of other thing, whether it could have been a burn or this ant bite mark, any excoriations like diaper rash or this simple drying up of this exposed part, like that you have to differentiate whether it is an actual abrasion, even if it is an abrasion, whether it is an antemortem abrasion or postmortem abrasion, that also we have to know. So this is the most important thing related to abrasion. And whenever they ask you abrasion, they will ask you one more thing, that is like why we call abrasion as a medico-legally significant wound. So, we say abrasion as a medico-legally significant wound. And why? Why are we calling that? What is the medico-legal importance of this abrasion? And this is a very important thing. So, first the medico-legal importance is that we can identify the direction of the force by seeing the epidermal tag, that heaping up of epidermis, that epidermal tag that we have seen earlier, right? By looking at that, we can identify the direction of the force and force of the impact. We have already said like it is a pressure abrasion and imprint abrasion. We have told now, like if it is a perpendicular force acting for a long time, it is a pressure abrasion. If it is a very large force acting upon a very small time, then it has to be a imprint abrasion. So like that, the force of impact, how long and how it acted upon body, we can identify. So direction of the force and the force of the impact we can identify. Then scene of the crime. How we can identify this is that sometimes there will be some foreign bodies, like some mud or some leaf or something. Okay, some scrap will be attached to your skin. Foreign body attached to the epidermis. By looking at that, we can identify the scene of crime and manner of infliction. If it is a grazed abrasion, we can say like it mostly happens in road traffic accidents, so mostly it can be accidental. And if you see nail mark, you can see like something, like mostly if it is a case of suspected homicide, you can see like somebody had tried to do something. If it is especially a case of throttling or something, you can identify the semilunar nail marks over the neck. So based upon the type of abrasion that you are seeing, you can even identify the manner of infliction. So manner also you can identify. Then depending upon the color changes, you can identify the time since injury. So we already saw, right, that R square, B square, depending upon the color of the injury, we can identify time of the injury. And weapon, by the imprint abrasion will give us the weapon. And if it is a linear abrasion, then we can say it has to be some pointed object. Like that, we can identify the weapon that led to the injury. So all these things, direction of force, force of impact, scene of crime, manner of the infliction, time of infliction, and the weapon that was used to inflict the injury, all these things we can identify simply by analyzing the nature of the abrasion. That is why we call this abrasion as a medico-legally significant wound. Clear? So abrasion, all the things that we have to get to know from this abrasion is direction of the impact, force of the impact, scene of crime, manner, time and weapon. All these are just by looking at the abrasion we are getting. That is why we call it as a medico-legally significant wound. And whenever you get the abrasion, you should be able to differentiate it from an antemortem and postmortem abrasion. If it is a burn or simply drying up or any excoriation like diaper rash or not, you should be able to differentiate that. And also this epidermal tag, which direction it is ending, there will be, you will have that epidermal tag. So these are the important things that we have to remember in abrasion. So with this we are ending the abrasion. Next we are going to see about bruise. So what is a bruise? So bruise is extravasation of blood. Extravasation of blood into the tissues. This is your bruise, and this is caused by a blunt force trauma. So here do you see some blunt force trauma is happening, and this is going to impact the blood vessel, and from the blood vessel the blood is going out. So the blood is extravasating and it is getting accumulated in the subcutaneous fat or between the muscle or tissues, like somewhere the blood will accumulate. So this is your bruise. So basically bruise is because of some blunt force trauma, there will be injury to the blood vessel and the blood will escape from the blood vessel and it will go deposit over the subcutaneous layer or inside the muscle or organ anywhere. So the blood will escape the blood vessel and deposit around the blood vessel. This is your bruise. This is the definition of bruise. Most commonly, the bruise goes into this subcutaneous layer. So this is the most common site of blood extravasation, right? So this is where you most commonly get the blood deposited, and there are few other types apart from the subcutaneous, which is your intradermal and deep bruises. So this is a deep bruise and this is your intradermal bruise. So this intradermal bruise, what will happen is that this is very superficial, like within the dermis, you can get the blood deposited, and even if it is very small amount, even the blood is small amount, you could see very bright and prominent bruise. Clear? So intradermal, this is very superficial and it will be within the dermis, and even a small amount of blood will look like a very prominent bruise. And subcutaneous is the most common site, and this is the commonest bruise that we encounter, and most commonly it will not be well defined. Not well defined margins. And next what we have is this deep bruise, and this deep bruise, it is also known as delayed bruise. So why we calling a delayed bruise is that here the blood will go accumulate deep within tissue. So within the tissue you will get the blood accumulation. Because of that, it takes time to come out. So usually what is the importance of this is that when there is an injury and when a deep bruise forms, like for example you take a case of some like torture, like somebody is like inflicting wanton pain to somebody and they are hitting over them, and what they would want, like to the injury not to be seen. So what they will do, they will usually strike over the region where it will not be easily seen, like your palms, soles, over the back, where you cannot easily find out the thing, because these are the areas where you have these muscle tightly woven. So the extravasated blood will go deep into these tissues muscle, it will stay there and it will not easily come out. Usually it will take up to 48 hours for these bruises to come out. So when you examine a patient with these kind of injury, and when you look them on the day 1, like when the injury happened, when you look at them, you won't be finding any bruises. But after 2 days, they will come to you and they will say, see, I have this injury, I have this very big bruise, I have this pain, but you have not treated me properly, you missed out this injury completely. I told you that I got injury over here, but you did not treat me properly, like that. They will come to you and they will complain. So the importance of this is that when you suspect a bruise over those areas, like where you have these muscle tissues very tightly placed, like all these places you have to carefully examine, especially in the scalp also. It will not be readily visible, you have to palpate. Only by palpation you will be able to identify the scalp bruises. So these areas you have to give some extra attention to find out these deep bruises. So this is the importance of this deep bruise. It is also known as delayed bruise. It will go deep into the muscle and tissue. Because of that, it will be visible only after some time. So it will take time to come out. So these are the 3 important types of bruises. Clear? Next, what is the associated finding that we normally see in these bruises? So the first thing about bruise is that the shape, and the shape, it does not correspond. It does not correspond to the size and nature of the weapon. So what happens is that, like this is a hammer, this will hit over here and you will get a bruise of some this much size. You will get a bruise of some, like let's say you are getting a 10 centimeter size bruise, but the actual striking surface of the hammer would be really small. It will be around only 2 centimeter. So like the strike, the nature of the strike and area of that impact, it will not correspond with the shape. And why we are saying this is that when that impact happens, the blood will go to the periphery, right? So the blood will go to the periphery. So because of that, you will get a center and peripheral differentiation. You will have a different color. You can identify a center and peripheral differentiation. It will not be uniformly colored, and there will be associated pain and tenderness. This is very, very specific along with swelling, right? These three. These are very, very prominent: pain, swelling and this tenderness. This is very, very prominent for all the bruises, and the shape, it does not correspond to the size of the weapon, and these margins, they are not fully defined, not well defined. And the extent, what happens is that even if it is a small injury, if it is a loose areolar tissue, the injury will spread more. The injury will spread over. So if it is tightly woven tissue, it will like accommodate into a small, very small space. Even if the striking surface is large, like only a very small surface will be affected. But if it is a loose areolar tissue, like the blood will start going away. So it will go cover all the area. It will go wherever it can go. So it will cover a large area and the extent will be very, very large. So by looking at very large bruise, we cannot say like some very big force has acted upon, like that we cannot decide. So this is the important thing about these bruises. So next we are coming to see certain terms in bruises. So depending upon the size of the bruises, we have divided the bruises into different terms. So first is your petechiae. When the size is like very, very small, these are the like small pinpoint hemorrhages. We call them as petechiae, and these petechiae we are most commonly seen in asphyxia. So these petechiae are commonly seen in asphyxia, and the size is usually 0.1 to 2 millimeter. Next come your ecchymosis. So when the size is between 2 to 5 millimeter, we call them as ecchymosis. Everything is bruise, everything is extravasation of blood, but depending upon the size, we are differentiating. So it's very small petechiae. Ecchymosis is 2 to 5 millimeter, and if it is more than 5 millimeter, we call it as bruise. That is the most common term that we use. And if it is like really big, the blood can be aspirated. There is a very big collection of blood and blood can be aspirated. We call it as a hematoma, like how we aspirate the pus fluid, like that we can aspirate the blood. When we do that, we call it as an hematoma. So if you see, just in alphabetical order, it is coming like P, E, D in a descending order. So here P is very small, ecchymosis is a bit larger than that, bruise is the largest among these two. So P, E, D, petechiae, ecchymosis and bruises. And hematoma, when the blood can be aspirated, we call it as hematoma. And there is one more term known as contusion. So contusion is if the bruise happens in internal organs like your brain, your heart. When the bruise happens in those internal organs, we call it as contusion. So everything is an extravasation of blood. Depending upon the site and depending upon the size, we are differentiating in them into different terms. We have the ecchymosis, petechiae, bruise, contusion and hematoma. So these are the other terms that we use for the bruise. Next, what we are going to see is a very special type of bruise. This is also known as migratory or percolated or ectopic bruise. So what we mean by this is that like the site of injury and site of bruise, it will be different. So that is why we call it as ectopic bruise. There will be impact over one side and the injury would be visible over another side. So the example for this is this one. First, this is also known as spectacle mark or raccoon eyes. So why we call it this as that, like here you will be seeing these bruises over eyes. Over your eyelids you will see the bruise, but actually the site of injury is here in the anterior cranial fossa fracture. The injury is over anterior cranial fossa, over the head, anterior cranial fossa get fractured. Because of that you get the extravasated blood, but because the loose areolar tissue is there in there, this will go down. The blood will trickle down and will come accumulate over this eyelids. So that is why we call it as an ectopic bruise, and this bruise, it gives to this typical spectacle like appearance and raccoon like eyes. Because of this we call this name raccoon eyes or the spectacle eyes or spectacle mark. So anterior cranial fossa, but you are getting bruise over the eyelids. So this is one example for ectopic bruise. Another example is this battle sign. So here there is posterior cranial fossa fracture, but you will see bruise over the mastoid. The bruise is seen over the mastoid region when the injury is actually in the posterior cranial fossa. So these kind of things where the injury is over one side and the bruise is seen over another side, we call it as ectopic bruise or migratory bruise. And this, since the blood is percolating through the tissue, we call it as percolated bruise. So this is one special type of bruise. There is another type which is also known as patterned bruise. Patterned bruise. So here what happens is that you can identify the weapon that caused the wound. See here, can you see this mark? See this bruise, like round bruise, right? So this resembles a penny. So we call it as penny bruises, like a penny coin. So we resemble it to a penny coin and we call it as penny bruises. And this penny bruises, it is commonly caused due to finger pads. When you like tightly push or grab using your finger, you will cause these bruises. So when you see the 6 penny bruises, we call them as 6 penny bruises, and we can say this penny bruises, it is most commonly due to this finger pad, and this is commonly seen especially in sexual assault and in case of throttling where the fingers will be pushing over these. So this, how we identify the pattern and how we correlate with the weapon that caused it, that is what we call it as patterned bruise. We can identify the weapon that has caused it. So this is your patterned bruise. And next to that, what we are going to see is another bruise, that is this railroad or tram line bruise. So this is also a patterned bruise, but here what happens is that this is usually caused by a thing that is pliable, like a wooden cane or lathi, something like that. Okay, something that can cause the skin to stretch. So for example, just imagine that a wooden cane is striken over here like this. They have struck the skin. What will happen? Like along the margin here, along the margin there will be stretching. There will be stretching of skin along the margin, right? And there what will happen? You will have the blood vessels extravasating the blood. So blood will come out. because of this stretching. And over the center here, over the middle, there will be only compression. And if there is no bony prominence or nothing, the blood vessel, it will be simply compressed and the force is released, it will just spring back to its original position. So, those blood vessels, it will not be affected. So, blood vessel are not affected. So, middle you have only compression and the blood vessel will not be affected, but in the margins, along the margin there will be stretching, because of that the blood will be coming out of the blood vessel. So, here only along the margin only you will see this bruises, while there is a central clearing. So, you will have a central clearing with marginal bruise, and this appearance is known as this railroad or tram line appearance. That is why we call it as railroad or tram line bruise. So, this is also a type of pattern bruise. So, when you look at these kind of injury, you can say that this could have been caused by these kind of cylindrical objects like a wooden cane or lathi, something like that we can say. And what is the most important thing about this injury is that, like in the real life, you will be seeing like this. You are seeing a bruise here and you are seeing a bruise over here. Now, what will happen is that people will think that they have used like two objects or they have used two strikes to cause this injury. Like they will consider these two as a separate injury. So, they will think like that there were two strikes or there were two objects or there was a pattern, like something like a fork caused this injury, like that people will mistake. So, that is the most important medico-legal significance. The medico-legal significance is that like it can create confusion of weapon identification. So, they will think that this is the actual pattern of the weapon, like the weapon was like this, like that they will think. But actually it was a wooden cane, right? It was a cylindrical weapon. So, just to have an idea about this, so that we will not be getting confused when you get these kind of injuries in real, right? We have to know this. So, that is the medico-legal significance of knowing these pattern bruise. So, here in this pattern bruise, they are matching the weapon and the bruise matched exactly. But here in this pattern bruise, the size of the weapon and the shape of the weapon, like that is the nature of the weapon, was completely different from the nature of the bruise. So, that is the significance between identifying these pattern bruises. So, these are a special subtype of bruises. So, we have seen this. Now, what we are going to see is factors that is affecting the size of the bruise. So, the first is that age. So, the old and young, that is the extreme of ages. People at extreme of ages, they bruise more. Like older people and babies, they will bruise easily and they will bruise more. And 6, who are having more fat, more subcutaneous fat, especially female or person with increased subcutaneous fat, they will have more easy bruises. So, more prominent bruises will be seen there. And build, that is obese people, they will have more significant bruises. And color, if they are fair skinned, they will have significant and large bruises, like it will be easily visible to the eyes comparatively to a dark skinned person. And embalming, when there is embalming that was done prior to the autopsy or prior to identification of the injury, this embalming, it can enhance the color and size of the bruise. Because what will happen is that the embalming, it will be pushing. So, we will be pushing all the embalming fluid into the blood vessel. Because of that, there will be increased extravasation of blood. So, the actual size and the nature of the bruise will change. It will increase in size when compared to the like pre-embalming phase. So, embalming, it will increase the color and size of the bruise. And type of tissue, if it is a loose areolar tissue, If it is a loose areolar tissue, you will have more prominent bruise. And the weapon and the size will not correlate. Weapon and the size will not correlate. So, these are the important factors that affect the size of the bruise. So, just by looking at these bruises, we will not be able to identify the nature of the injury that has caused the thing. And there are certain complications to the bruise. When there is like large extravasation, very large amount of blood has extravasated, there will be shock. And due to continuous, like very long standing chronic extravasation, there can be sepsis. And if there is any contusion of the internal organ, especially brain, contusion of the internal organ or brain can result in severe pathology. So, these are the most important complication of the bruises. And another thing that we have to see in bruise is that this bruise and postmortem staining, that is your hypostasis, in the autopsy table, if it is present over the back, both of them, both the bruise and hypostasis is present over the back, it is really hard to differentiate these two without using certain techniques. So, what happens is that here, see, this is present over the back, you can see this discoloration, and this also present over the back, and you can see this discoloration. So, what you have to do is you have to differentiate whether it is a hypostasis or it is a bruise or contusion, that we have to differentiate. So, how we will differentiate is that the first thing, most important thing is this incision test. So, this is your incision test. So, what happens is that when you make an incision over a bruise, okay, when you make an incision over bruise, you can see this red color, this discoloration will be there. If it is the hypostasis, this color will be absent, this discoloration will be absent. So, this is how you mainly identify a contusion from a hypostasis. So, this is the main difference. Apart from that, there are few other differences between hypostasis and bruise that we have to know. So, first difference, what is the cause of hypostasis? It is the staining. Due to the gravity pulling, you have staining of tissue. After death, there will be disintegration of the cell and there will be pooling of the blood, and that pooled blood, it will cause discoloration of the surrounding tissue. This is the mechanism between formation of hypostasis. What about bruise? In bruise, what will happen? Because of the blunt trauma, you have a blunt trauma that results in extravasation of blood. So, you have RBCs coming out, you have blood coming out of the blood vessels due to this blunt force trauma, extravasation of blood. So, this is the cause. Next, what is the place of collection? It is mostly seen in the dependent area. It is mostly seen in the dependent area. If it is supine over the back, if it is lying over the sole, palm and leg and arm. So, this is the area of collection, but here contusion, it can occur anywhere. Anywhere in the body you can identify contusion. And what is the extent? There is no limit, okay, like wherever the position is there, like all over the back, all over the dependent part, like well, this is well established. All over the dependent area. Here it is not like that, like only over the area of impact, like wherever the blood could go, only over that area you will be seeing this bruise. It will not be widely seen, all over the body it will not be seen, but this hypostasis sometimes all over the back except for the pressure area you can see this hypostasis. And site, what happens is that this site, this is like very commonly absent in pressure areas. If it is present over supine where the body is contacting the surface, that area it will not be present. Hypostasis if a pressure is applied over that area, that hypostasis will not form. But here it is not like that. It can be seen anywhere. There is nothing like pressured area it will not see. So anywhere over the body you can see this. And this incision test, we have already seen this incision test. So hypostasis there will be absent after the incision, but here there will be this discoloration, presence of discoloration during the incision. And if there is blanching, if there is pressure applied, when you apply pressure, if it is not fixed, you will see blanching, and if it is fixed, it will not blanch. But here always there will not be blanching. So always no blanching. You cannot see any blanching in the bruises. And swelling, it will be absent here, and in case of bruise you will have marked swelling. The swelling is one important feature of bruise. And margin, it is not well defined. It is not well defined. Here it is well defined. You can easily differentiate this like area of bruise and normal area. Hypostasis, it will very superficially it will go and merge with the normal skin. So this proper margining will be seen in this bruise. And abrasion, it will be absent here, and here in few cases, some cases you could see abrasion. You will see contused abrasion when the force is very impactful. You can see this abraded contusion or contused abrasion. So these are the main differences between a hypostasis and contusion. So this is a hypostasis and this is a contusion, and this is your incision test. So the main difference is that the blanching and this incision test. So these are the important differences, and swelling also important. So these are the main differences between postmortem, hypostasis and contusion. And next what we have to know is the age of bruise. So this is another important thing that we have to know. So first, initially when the injury occurs, it will be very red in color. You will have this red bright color, and this is mainly due to oxyhemoglobin. Due to presence of oxyhemoglobin, you will have these bright red color. Now what happens is that as the time passes, this hemoglobin, it will start degrade. This hemoglobin will degrade and you will get all the hemoglobin pigments, and that pigment, with each pigment you will get each color, and depending upon the color we can stage the injury. We can identify the age of the injury. So that is how we are going to do. So first it is fresh because of the presence of oxyhemoglobin. You will get to see this red color, and after some time this oxygen will pass away. So what you will get is this blue color. So you will be getting these blue color due to this deoxygenated hemoglobin, and this will happen in hour to 3 days. Between 3 days, hour to 3 days, you will be getting to see this blue color due to presence of this deoxygenated hemoglobin. After that, what you will get is this brown color. By the 4th day, you will get this brown color, and this brown color, it is due to presence of the hemosiderin pigment. Hemosiderin pigment. You just remember stabilizer. S-T-B. Stabilizer, just remember. So first you have hemosiderin, and which cause brown color on the 4th day. By 5th to 6th day, you will be getting the green color of the wound, and that green color is due to hematoidin. Hematoidin. See, S-T. Hemosiderin, you get the brown color, then green color due to hematoidin. Then finally, you will get this yellow color. This yellow color is caused by the pigment bilirubin. So you get bilirubin yellow color by 7 to 12 days, and after 2 weeks it becomes normal. So you have to remember the color and also you have to remember the pigment that causes this. At what stage what color will happen and what color was happening because of what pigment. So these things you have to remember. So first it will be fresh and red because of presence of oxyhemoglobin. Then it will become blue because of the deoxygenated hemoglobin, and this will happen between few hours to 3 days. Then by 4th day you will get the brown color due to hemosiderin. This pigment you can remember STB, stabilizer, hemosiderin. Then green hematoid in 5 to 6 days. Then 7 to 12 days yellow color due to bilirubin. So depending upon the color you can identify the age of the bruise, and this age of the bruise is very important. And all this is happening because of the degradation of our hemoglobin. So that is the important thing that we have to remember. Why this color change happens is this hemoglobin's degradation and the hemoglobin pigments giving the color. So this is the mechanism behind these color changes. And the rate of healing, it differs with each and every individual, like how the factors that affected the size of the bruises, like that also the rate of healing differs. Like what happens is that it heals from periphery to center. So from the periphery to the center it will heal, and this heals in case of adults, like faster healing in case of healthy adults. So this is the rate of healing, and there are lot of other factors that like affects the rate of healing. It is not the same, like depending upon the health condition, depending upon your hemoglobin level and all, the rate of healing will differ. So we cannot say that this is how exactly it will look like in 7th day. Exactly the 5th day you will get this green color, like that you cannot say. There are a lot of factors which will affect the rate of the healing, and there are certain special cases where this color changes will not be readily visible. Example is this subconjunctival bruise. Here what happens is that directly from red color it will become yellow color. So this subconjunctival bruise, all these discoloration, this brown color, green color, it will not be visible. You will directly get the yellow color. And in carbon monoxide poisoning you will have this bright red color. Get the bright red color bruises. So these are the special cases where this color changes are normally not followed. And if there is a deep organ contusion, especially if there is contusion of the brain, depending upon the center involved, you will get pathology. So if respiratory center, if medulla is affected, you will get respiratory failure. So depending upon that you will get. And if there is contusion of heart, this is known as commotio cardis. There can be sudden death. So depending upon the area of contusion, which organ is contused, you will get the complications. So these are deep organ contusions. So these are the important aspects that you have to remember in case of bruise. And most important medico-legal significance of bruise is this artificial bruise. So what will happen is that sometimes people will self-inflict bruises by themselves without using any weapons. What they will do is they will use some irritants, plant irritants. They will use some plant irritant and they will cause bruise like injury over their body, and this is mostly self-inflicted. For feigning, like just to escape something, to escape from a class or to escape from some accusation, they will do this by themselves and they will feign some injury. So this is usually done by using 3 plants. Those are these. This is your lumbago, calotropis, then semicarpus, anacardium. So these are the 3 commonly used plant irritant to cause these artificial bruises. So mainly what will they do is they will take these plant irritant and they will rub it over their skin and it will produce bruise like injury because of its irritant nature. So how to differentiate these true bruise from artificial bruise, we will see. So what is the cause? This is mainly due to mechanical trauma, like a blunt force trauma will lead to this, but here it is due to irritants, due to irritant action. And this site, it can occur anywhere, but here it is mostly over the accessible part. In the accessible part, you will be seeing this bruises because most of them are self-inflicted, so it will be seen over the accessible areas. And next to that, the color. See, I told you, right, that because of degradation of the hemoglobin, you will be seeing this all sort of colors, okay. This degraded hemoglobin will lead to different colors, but here there is no such color change because there is no hemoglobin extravasated, right. So, there will not be any degradation of hemoglobin. So, you will not be seeing any color changes like these green, yellow, brown, all those things will not come. Here in case of true bruise, it will come, and the shape here it is mostly like oval shape or something. Here like there is no such shape, like depending upon how they used it. It like wherever the irritant acted, you will have these shape. And here margin, it will be kind of merging, and you will not be seeing like any vesicle or anything, but you will be seeing abrasions. But here you will be mostly seeing vesicles, but no abrasion. Abrasion will not be seen, and itching will be absent. Here itching will be present. Vesicle, it will be absent here. Here it will be present. And when you cut open the bruise, the content you will have blood. Here you will have some acrid serum. You will have these serous exudate present inside the swelling. And redness and inflammation, it will be seen around the margin of the wound. But here over the wound you can see this inflammation and redness. So, when you subject it to chemical testing, you can identify these plant irritant component in this artificial bruise, but here you will not be seeing these plant irritant component in chemical test in case of true bruise. So, the main difference is that you will not be seeing that color changes, you will not be seeing these marginal abrasion or anything. What you will be seeing is this vesicle formation and redness and inflammation over the injury. That is how you differentiate between a true bruise and a artificial bruise. So, these are the important thing regarding the bruise. So, bruise, what are the types of bruises that we have to know, and the special types like your ectopic bruise and the pattern bruise, where you see the exact pattern like your thumbprint impression, Prenny bruises, or where you don't see the exact pattern like your tramline bruises. So, the main difference between those bruises, what are the factors that affect the size of the bruises, and what are the things that causes the artificial bruises like lumbago, calotropis and semicardis anacardium, and how you differentiate between these two, how you differentiate a hypostasis and a bruise. All these things are very important to know. So, up next what we are going to see is laceration. So, laceration, it is also blunt force trauma. It is also a blunt force trauma, and the laceration, main thing that we have to know is in the margin you will have abrasion or contusion, and this is mainly tearing of tissue due to stretching, them beyond their elasticity. Beyond their elasticity, you will stretch the tissue, so there will be tear in the tissue. That is what laceration is. So, because of this blunt force trauma, along the margins you will be seeing either an abrasion or a contusion, and the depth will be depending upon the force, depending upon the intent of force. If it is more force involved, you will have a much deeper laceration. If it is less force, then the depth of the laceration will be smaller. So, depending upon the nature of the force, how impactful was the force, the depth will be decided. And the shape, no specific shape. It can be of any shape, it does not correspond with the weapon. And this gaping, like tissue gaping, this is very prominent. This tissue gaping present, and you will get to see tissue bridges. That is, you have like threads of tissues between the surface. Like you will have the tissues interconnecting, like very small thread of tissue interconnecting the area of the injury. These are known as tissue bridges. This is very prominently seen in laceration, and along with that the hair, it will be crushed, especially your bulb, it will be crushed, and we can also see all the nerves and blood vessels crushed. So these are the common features of laceration. When we say laceration, there will be tearing of tissue along with presence of gapping, tissue bridges, and the crushing of the hair bulb, nerves and blood vessels. Now what you are going to see is type of laceration. So type of laceration. So first, this is your tear laceration and this is your split laceration. So here what happens is that when this blunt force trauma acts in an area with sufficient subcutaneous fat or tissue, you will be getting this tear laceration. So this is the most common type of laceration that you encounter, and this is what you get when there is enough or sufficient subcutaneous fat tissue present. So this is the one type, tear laceration, and this is usually caused by blunt object like cricket bat, hockey stick. These kind of blunt objects, it can cause this. So next is your split laceration. So this split laceration, how it happens is that when there is laceration, blunt force trauma over area with no or less subcutaneous fat tissue, you will get this, especially over scalp, shin. So these are the common area where you will be getting this split laceration, and this split laceration, it is also known as incised looking lacerated wound. So since it is looking like an incised wound, but it is actually a lacerated wound, we call it as incised looking lacerated wound. So these are the main types of laceration. So first is your split laceration, another is your tear laceration. When there is enough subcutaneous tissue, you get these tear laceration, which is the most common laceration we get, and if there is not enough subcutaneous tissue, especially over areas like scalp, shin and your chin, you will get this split laceration, which is otherwise known as incised looking lacerated wound. So this is the first two type of laceration, tear and split laceration. Up next, what we have is this, which is known as avulsion. So here what happens is that there will be a force which acts upon the area and it will grind away the tissue. So basically you will have a grinding force acting upon an area like your car tire. So this car tire, what it will do? It will grind and you will get these kind of laceration. You will have the skin, tissue, everything lacerated, everything torn. So that area, it will be grinded away. There will be a centrifugal force acting upon that. All the tissue, it will go along with that grinding force and it will be teared. So this is how the avulsion happens. So avulsion is the third type of laceration. And next what we have is this. This is also known as flaying or stretch laceration. Here what happens is that there will be tangential glancing force. So you have this tangential glancing force which will scrape away the skin. So mostly the skin will be absent. So there will be absence of skin. That is why it is known as flaying. And this is commonly seen with glancing wound. Like when someone is like kicking, like glancing, sliding over the surface, you will get these flaying or stretch laceration. So this is how the stretch laceration will look like. And finally you have this special type, that is your chop wound. So here what happens is that you have laceration along with incision. This is a hybrid of incision and laceration. So what here happens is that you have a heavy cutting sharp weapon. The weapon will be heavy and sharp, but it will not be too sharp. Like you have your axe, machete, these kind of heavy cutting weapon which will result in these tear. And the main important feature of this chop wound is that there will be presence of fracture. You will have fracture of underlying bone. It has to be there. If it is a chop wound, definitely there will be fracture of some bone. Then you will have the crushed tissues. Everything will be crushed. Along with that, you will be seeing bridging of tissue. You will be seeing crushed tissue, bridging of tissue along with the fracture of the underlying bone. Here you can see you have multiple sharp cuts along with tissue bridging. So this thing that you are seeing here, like a thread is going, right? So these are the tissue bridges and all the area, everything will be crushed. So this is the chop wound and very important subtype of laceration, and it is caused by this heavy cutting sharp weapon, especially your axe or machete. So these are the important subtypes of laceration. You had tear laceration when there is enough subcutaneous tissue, most common type of laceration that you will get. Next is your split laceration, where you will be getting is that when there is no subcutaneous tissue, like your scalp, shin or chin, and it is also known as incised looking lacerated wound. Next to that you had avulsion, where there is a grinding force like a tire mark running over your leg, which will avulse all the tissues away, which will crush all the tissues away, that is avulsion. Next you had stretch or flaying, where there will be a glancing tangentially acting force which takes away your skin and crushes your tissue, that is stretch laceration. And finally this chop wound, which is caused by a heavy cutting weapon like an axe or machete, where you will definitely have a fracture of the bone along with the crushing of the tissues underneath. So these are the important type of laceration that we have to know. Now I already told you that there is something known as incised looking lacerated wound, right? So incised looking lacerated wound. Now it is very important to differentiate this incised looking lacerated wound from an actual incised wound. Why is that? Like when you look at them in the autopsy table, like when you get an injury over the skull, over your forehead, you will be confused whether it is a laceration or incision. So how you differentiate these two is very important. So how you will differentiate is, then the first thing, you have to look at the margins. The margins here, it will be very clear. There will not be anything. But in case of laceration, you will have abrasion and contusion. either of this will be definitely present in case of laceration. So by looking at the margin you can differentiate. If not, what you can see is that there will be irregular margin absent. Here it will be present. And next you can see is the hairball, which will be clearly cut. Here it will be crushed. And next, your blood vessel and nerve, that also clearly cut, but here it will be crushed. And because of this clear cut here, hemorrhage will be more. But in case of this laceration, hemorrhage will be less. So the main differentiation is that there will be this marginal contusion or abrasion along with this irregular margin, and you will also getting to see tissue bridge. This tissue bridge will be absent here, while here it will be present. So this is how you differentiate a true incised wound from an incised looking lacerated wound. So main difference between these two is this tissue bridge, crushing, and the marginal contusion and abrasion. This is how you differentiate in the autopsy table. And while differentiating this, we have to differentiate one other thing also, that is a tentative cut. So what a tentative cut is that these are also known as hesitation wounds, and these are mostly self-inflicted, and people with suicidal tendency most commonly seen, especially in hanging cases you will be seeing this, and it is commonly seen over accessible areas. And what you will be seeing is that you will be seeing multiple superficial, parallel cuts. So most commonly we will be seeing them over the wrist. So in the wrist there will be like this, like serial of cuts. There will be multiple cuts. You will be seeing parallel, and it will also be superficial. Like you will have these continuous cuts over here. Over the wrist you will be seeing. Sometimes it will be confusing, like something could have some imprinted abrasion or something happened like that, it may be confusing. So you have to look at that. If you have very superficial, multiple these kind of cuts are seen, then it has to be a tentative cut, which is a subtype of incised wound. So it is an incised wound caused by a sharp weapon. Since it is like very multiple and superficial, this may be confused with something else. So that we have to know. And it is commonly seen in this accessible area, and it will be multiple, superficial and parallel. So when they ask you like what is a injury, what is the type of injury, this tentative cut, you have to say it is a type of incised wound. So that is the thing we have to know. And this difference between lacerated wound and the incised wound is very, very important, which will be very much useful in your practicals. So with this we are ending that laceration. Next what we are going to see is this incised wound. So incised wound, we are starting the sharp force trauma. Then there is a sharp force, like sharp weapon. You have your knife. It will lead to this incised wound. And this incised wound, the main important feature is that always in all incised wound, length is more than the depth. Length is more than the depth of the wound. That is the most important character of this incised wound. When there is a sharp wound and you get the length more than the depth, we call it a incised wound. If the reverse happens, a sharp injury where the depth is more than the length, we call it a stab wound. So this length and depth mainly differentiate these. Whether it is an incised wound or depth wound, it depends mainly upon this length and the depth. And In case of incised wound, you will get certain things known as skipping pattern and tailing of wound. So what is this is that, like skipping pattern means when a knife is giving an incision, if there is obstruction, there is obstructing areas in between. Like for example, if someone is giving an incision over this area, over the axilla, like in the arm there will be incision, then over the fold of the axilla there will be some skipping, then it will go to the chest area. So like this, you will have the skip in pattern when there is something obstruction, some sort of obstacle is present in the way. You will get this skip in pattern. Or sometimes what will happen, they will have some foreign object, like they will have some watch or something present over their arm. So if someone is giving an incision, there will be incision present over the palm, and over the wrist it will be missing, it will be present over that watch, and it will be present over the area beyond the wrist. So like that you will be able to visualize the skip in pattern. And next thing that you can see is this tailing of wound. What this tailing is that, like at the starting it will be deep, and as it goes towards the end it will be superficial. So this is known as tailing of wound. When they start, they will start deeper, and when they go towards the end, it will become much superficial. So this is known as tailing. So this ending point is known as tail and starting point is known as head. So like that you can identify the direction of the force. So this is known as tailing of wound. Then gapping. Gapping is very, very prominent with incised wound, and it is commonly seen if the incision is made transverse, and if it is longitudinal, it is absent. So this gapping is like when the width of the injury, it will gape more, it will open up more, that is gaping of the wound, and like because of the lines of the langur, this gaping will become more prominent if it is cut transversely. If it is going longitudinally, then this gaping will not happen. So next, something known as beveled cut. Here what happens is that there will be tangential force. Like instead of putting an incision like this perpendicular to the skin, they will tangentially, like in a sliding way, incision is made. So they will just cut like that, they will slash. So this is your beveled cut, beveling cut or beveled cut, this is what. So these are the important aspects of incised wound. You will have skipping pattern, you will have tailing of wound, you will have the length more than the depth, then you will have gaping more if the incision is made transverse, and there will be beveling cut when the incision is like slashing, when the slashing wound is made. So these are the important aspects of incised wound. Apart from that, you also have these hair, blood vessels and nerves sharply cut. Since it is a sharp force trauma, you will get the sharply cut nature of all these wounds. And the most important incised wound that we have to know is this cutthroat injury. This cutthroat injury, it is a typical example of this incised wound. And cutthroat injury, you can get either suicidal or homicidal, both is possible, and the difference between this cutthroat injury we have to know. So first, which side, like how the cutthroat injury looks, that is important. Like if it is a suicidal wound, what happens is that most commonly, like if it is a right-handed person, they will start from the left to right. Left it will be deep, and here it will be superficial. This is how it will look. It will be deeper starting from the left side, and it will go superficial and it will go to the right side. This is how suicidal looks like that. But homicidal, no such differences. Like all over the neck, it will be in the same depth. Okay, there will not be any superficial to deep or deep to superficial changes. It will be the same all over the neck. And level, it will be mostly high, above thyroid. It will be lower. It will be most commonly at the lower level, but when they are doing, they will be doing high, above the level of thyroid. And it just what happens is that there will be multiple cuts, but here there is no, only single cut will be there. There will be some like irregular cuts, like they will try to cut, they will do multiple cuts, they will be hesitating. So this hesitation cut, it will be present here while it will be absent here. So this multiple cut, hesitation cut, everything will be present only in suicidal wound, not in homicidal wound. And tailing of wound, it will be present here in superficial, in the suicidal wound, while here it will be absent. And neck vessels, like mostly when the person is doing like cutting the throat, they will like raise their head. Because of that, all the vessels, this will go beneath the sternocleidomastoid muscle. So they will escape the cut. So these vessels, they will be intact. Since they are like raising the head like the residing the head, it will go inside. The sternocleidomastoid will come forward. It will prevent the neck muscle. So because of that, you will not be seeing cut of this neck vessel mostly. But here nothing like that. Neck vessels will be cut. So this is the main thing that we may be seeing in the suicidal cutthroat. And defense wound, if it is a suicidal, it will be absent, but here it will be present. And cadaveric spasm, this is most commonly seen with the suicidal cutthroat, especially they will be holding the knife. This pattern, it is most commonly seen, and in this cadaveric spasm may or may not come, and if it is coming, mostly they will be holding on to the assailant, like they will be holding on to that murderer. So their arms will be like that, or they will be holding some of the like buttons or shirt or something of the assailant. So they will not be holding the knife like that. So this is the main difference between a suicidal cutthroat and a homicidal cutthroat injury. So the main thing that we have to remember is this, like hesitation cut where it will be present, and this level, it will be high, and the neck vessel where it will be spared and where it will not be spared. So this is the main thing we have to remember in this cutthroat injury. So next is your stab wound. So when we say stab wound, it is also a sharp force trauma. So it is also a sharp force trauma, and here what happens is that you will have the depth more than the length. So when you have the length more than the depth, we call it an incised wound. When you have the depth more than the length, we call it a stab wound. And this stab wound, it is of 3 types. So what is the type of stab wound? So the first is this. This is your puncture wound. So this is the puncture stab wound. So here what happens is that there will be very small puncture, most commonly your injection or something like ice pick injury. There will be very small stab, very pointed, pinpoint, pointed weapons which will cause this injury. So next type is your penetrating stab wound. You have the penetrating stab wound. Here what happens is that the weapon, it will enter the cavity. Some cavity, you will have the abdominal cavity, thoracic cavity. So some cavity, the weapon will enter the cavity and it does not come out. Right? Does not come out. So this is your penetrating wound. Finally what you have is perforating wound. So here what happens is that the weapon, it will penetrate and it will come out. The weapon will go in and come out. So these are the 3 types of stab wound. So when you have the depth more than the length, we call it as a stab wound. And these stab wound, if it is only a puncture, small pinpoint weapon, it is known as puncture wound. When it enters the cavity, does not come out, we call it a penetrating wound. When it enters the cavity and comes out, we call it as a perforating stab wound. So this is the important type of stab wound that we have to know. And in case of stab wound, what we have to know is that while writing the feature of a stab wound, there are certain things that we have to definitely mention. So what are those things? You have to mention the size, that is the length, width, depth, everything has to be mentioned. Then what is the direction of your wound? What is the direction of your wound? We have to mention. Then you also have to mention like whether it is coming out or not. Like what is the track of the weapon? All these things you have to explain in detail. Entry and exit point. Everything, how it entered, what is the size of the injury, and how it travelled inside your body, and how it exited your body. All this thing you have to mention in your report. And while mentioning this, what we are trying to ascertain is that depending upon the wound dimension, we can identify the weapon that could have caused that injury. So how we correlate is that this is your wound, right? So this is the wound, and you can see this is the length of the wound, and this is the width of the wound, and this is the depth of the wound. So this is your skin, and inside it goes into your body. So this is the depth of the wound. So you have the length, you have the width, and you have the depth. Now you take the knife. So knife, this is the, so if this is a knife, this is the knife, you have the width of the knife, you have the length of the knife, this is the length of the knife, and you have the thickness of the knife, right? So like if this is the knife, this area, this forms the thickness, right? So this thickness of the knife. So everything will be measured in the knife, and how we are correlating is that the length of the wound will correlate with the width of the knife. So this length, this will correlate with the width of the knife. So length and width will correlate. Now width of the wound, that is this thing, this width of the wound, it will correlate with the thickness of the knife, this thing. So this thickness we measured, right? This thickness will correlate with the width of the wound. Next, the important thing, that is your depth of the wound. So this depth, this will correlate with the length of the knife. This whole length of the knife will correlate with the depth of the wound. So this is how you correlate the wound dimension and the knife dimension, and you will try to say whether this knife could have caused the stab or not. That is how you write your PM report, that is how you write your weapon report. So these are the important things that we have to know. So basically you will take all the dimension, you will take the depth and what is the direction, how it entered, how it travelled through the body, how it exited the body, everything you have to mention, and you have to take the weapon, and weapon dimension and wound dimension you have to correlate, and you have to give an opinion whether this weapon could have caused injury or not. Like that you have to give the weapon report. This is why all these things are important to be noted down in a PM report. And apart from this, we can also identify the nature of the weapon by looking at the shape of the stab wound. So generally you have a single edge weapon and double edge weapon. So double edge means both sides are sharp, and single edge means only one side is sharp. So knife, you have kitchen knife where only one side will be sharp. You have other types of knife like your katana and all where both sides will be sharp. So you will try to see like whether this shape will correlate with a single-edged weapon or double-edged weapon. So generally, if it is a single-edged weapon, that is a knife with only one side sharp, what you will get this is this teardrop shape wound or wedge shaped wound or this fish tail shaped wound. Only these three are possibility. Like this, only this sharp edge, this is due to sharp, this is due to sharp, and this is due to sharp, and this end is due to blunt edge. So these are the three shapes, only three shapes you will be getting with this single edged weapon. And if it is a double edged weapon, you will be getting this spindle shaped injury, like both side will be sharp. You will have sharp corners like this. So depending upon the shape of the stab wound, we can identify whether it was a single edged weapon or a double edged weapon. And most important thing about this stab is that this lines of Langer, this will greatly affect the shape of the wound. Like if the stab is along these lines, then there will be no gapping. But if it is perpendicular to line, then there will be massive gapping. So because of that, you will be like having very big confusion. You have to approximate the body and then you have to find out the dimensions. If you don't approximate and do the dimension, there will be very big differences between the dimension of the wound and the dimension of the knife. And apart from this, see, this is how it will look like. These are the lines. If you stab longitudinally, like along the line of Langer, there will be no gapping, and if it is perpendicular, there will be gapping. So this is how it will look like. So you have to approximate the wound. And another important feature is the hilt mark. So this hilt mark is something which is very specific to the knife, and this is nothing but a abrasion. So this is your hilt mark. Because of the hilt that is touching upon your body, there will be abrasion, and that is known as hilt mark, that will be used to identify the exact knife that was used to stab. So this is the importance of the stab wound. And medico-legal significance, the first thing is that this harakiri, like this is a suicidal stab wound to abdomen. And next what you have is concealed puncture wounds. So what happen here is that sometimes there will be very small puncture wound over nape of neck, or sometimes snake bite over very non-conspicuous area. There will be very hidden area, in there you will be seeing this puncture. So these concealed puncture marks sometimes will be missed in the autopsy, thereby missing the exact cause of death. And these nape of neck, they will intentionally puncture and try to injure the medulla, like a homicidal reason they will use. And the direction of the wound, we have to identify the direction of the wound so that only the exact position of the victim and assailant can be identified. And shape of the wound, it differs very much with the lines of Langer, and that is also one important aspect. And shape of the wound, if we make mistake, then the weapon identification will become very hard at the end. So these are the important medico-legal significance of these stab wound. So with this we are ending this stab wound. Next what we have is another peculiar type of wound, that is your defense wound. So this is defense wound. So this defense wound, what will happen is that here you will be seeing certain types of injury. If it is a sharp force trauma, you will be seeing incised wound. If it is a blunt force trauma, you will be seeing abrasion, fracture and sometimes contusions. This is seen over the victim. In victim you will be seeing this. Like this is mainly because they are trying to prevent themselves from getting injured. They will try to prevent themselves from getting injured. This is how these injuries are formed, and they are known as active defense wound and passive defense wound. Active defense wound means they will try to grab the weapon. They will try to attack and prevent. If it is a passive defense wound, they will only be defend themselves. Only they will defend. And these active defense wound, you will be mainly getting cuts over palms. In passive defense wound, what you will be getting is that you will be getting these cuts over the dorsal aspect of hands and forearm. Like when they are simply defending, they will get injury over the dorsal aspect and the forearm. And if you are like trying to grab actively to prevent them from getting injury, if they are trying to hold a knife or trying to hold some log or something, they will get injury over the palm. So this is the difference between active defense wound and passive defense wound. And next is that you have something known as offense wound. So what happens is that they will try to attack the assailant. The one who is hitting them, they will try to attack them. They will punch their mouth, and because of that they will get some contusion over the knuckle. So this action, this contusion, it will be seen in the victim. This is known as defense wound that happens due to attack, right? So because of the attack, they will get some defense wound. They will try to attack the assailant and they are getting this contusion over the knuckle. That is the defense wound due to attack. Now what is offense wound is, that is normally that you are trying to attack. This is by the attacker. Attacker causes injury to victim and he gets injury. Like they will try to punch, and because they are punching repeatedly, they will get contusion over fingers. So since they are offending, since they are attacking, they are getting injury. So this is the offense wound. So defense wound due to attack is the victim while defending, he will attack the assailant. Because of that, he will get an injury. That is defense wound due to attack. Offense wound is you are offending someone and that attack is leading to some injury over the body. That is your offense wound. So this is the important thing about this defense wound and offense wound. So you have active defense wound, passive defense wound. Active, when you are trying to prevent the attack by actively doing something. Passive is when you are simply preventing from getting attacked. And offense wound is while attacking you get some injury. Defense wound due to attack is to prevent yourself. To defend yourself, you are attacking and you are getting some injury. That is defense wound due to attack. So these are the important aspect about these injuries. With this, we are concluding the mechanical injury. Abrasion and bruise are very important, and types of laceration also very important. And thank you for watching.